It's crazy that this is happening.
Yeah. Hey.
Can I have your first and last name?
Jennifer Gobrecht. Try not to freak out too much. Okay.
It's gonna be a little bump coming up, okay?
All right.
You're gonna do great, okay?
Stop crying. It'll be okay. Love you.
You're gonna do great, okay? I'll see you when you wake up.
All right.
That's a good one.
We got baby pictures of Drew.
Yeah, the baby pictures.
Potentially what our future children will look
Oh, God.
like. You are cute.
We've only just started having these conversations, the conversations of what's it gonna be like to have kids, because it was never, we never talked about the
More
after.
immediate,
It was
yeah.
always like, how do we even get to that point? That was always the conversation.
We understand like how to keep a child alive, but other than that,
Probably not as prepared as we should be because we haven't thought about that part of it.
I was going into my senior year of high school when I finally was officially diagnosed. Because my uterus never fully formed, I would never be able to have children naturally.
When Jen got the diagnosis, it wasn't, it'll be hard. It wasn't, you'll have to take extra steps. It was, it's not possible. She can't give birth. We could have had kids through a surrogate, we could have adopted, but Jen would never be able to carry children.
To be able to have a family with Drew in a more natural way, I never thought that this would ever be an option.
I see patients with uterine factor infertility, and I was never satisfied with the limited options that they had. We say, okay, the best options for you are gestational surrogacy or adoption. I'm very glad those exist, but for many patients, they didn't really satisfy the way in which they wanted to achieve parenthood. So we really saw an opportunity to develop a both clinical uterus transplant program and a robust research experience for uterus transplant.
I thought that this was an outstanding opportunity to be able to actually take transplantation into a new domain and to care for a patient population that prior to this has never been served by the miracle of organ transplantation.
Jen and Drew really stuck out. They had a really good understanding of uterus transplant before we even sat down.
We had seen that they were doing uterus transplants around the world, but we never thought of it as a possibility.
When I saw that Penn was doing one, I had said, you know, I'm gonna apply for it. We're looking into these types of options. This is another option to explore.
They were dedicated not only to their goal, which is to have a child and to have Jen carry that child, but if it didn't work, to advance the field of uterus transplant.
And what Jen said to me blew my mind, because she said, even if we take part in this and we don't get the outcome we're looking for, we could potentially help someone else in the same position as us.
This is the consent form, so I, Jennifer Gobrecht, Drew Gobrecht.
It's a credit to Jen and Drew's exceptional courage that when they started this, there had not been a successful birth from deceased donor transplant recipient.
It wasn't until we got a call from Dr. O'Neill and she asked to meet with us that it's sort of sunk home. And then she went into great detail and explained exactly what was going to be involved in the study.
Once they're selected as a good candidate for the trial, they need to undergo in vitro fertilization to create embryos. They have their organ transplant, and then ideally 6 to 12 months after their transplant, we begin attempts at pregnancy with embryo transfers. If they successfully achieve pregnancy, we monitor them until 37 weeks. These women cannot deliver babies vaginally, so they have to have C-sections. After one live-born child, if they would like to try again, 6 months after their C-section, we try embryo transfers again. Up to 2 live-born children are provided for in our trial. And then at the end, we remove the uterus and they stop the immunosuppressive regimen. We waited for an appropriate donor to become available. What that consists of is, unfortunately, an individual undergoes a catastrophic event and is donating their organs.
The phone goes everywhere because that organ offer can come at any time.
We could get as little notice as 12 hours. So you could get the call and have to basically go to the hospital right away.
I remember exactly where I was when I got the phone call and how everything else just stopped. Dr. Latif and I walked out of my office suite and I looked at him and I said, "This better work." We left the hospital to go out and procure the organ.
The phone rings. I see that it's Dr. O'Neill and I pick it up and I'm like, hello?
It was shocking.
You just signed your name right here? Which arm would you prefer?
This one.
It felt very urgent in terms of like emotionally. It was like, oh my God, this is happening right now. This is crazy. But like when you get to the hospital, we were waiting for Dr. Port and Dr. Latif to finish up retrieval of the organ, the transport.
Oh, so you did 2 swabs.
Dr. O'Neill was up to her elbows and helping make sure that all the players were exactly where they needed to be.
No, we can now. Yeah, that's fine. I was waiting for the call. No, unfortunately, doesn't look suitable for transplant. But she called and said everything went well, we're coming back. I was so excited to go tell Jen and Drew because I'm Dr. Doom. I tell these patients there's no guarantee. So to tell them we're going to do the transplant was really an incredible moment.
Are you gonna walk to the stretcher?
Putting her on the bed, walking her down. It's like sinking in for me at that moment.
The family members are the people that I actually always worry about because that's the time when we take the precious cargo away from them and that's when it makes it real and they get scared.
You're gonna do great, okay?
Stop crying.
I'll see you when you wake up.
All right. I definitely was nervous, but I just kind of knew, like, okay, well, it's now and it's happening.
Ready? All right, Jen. Ready?
Ready?
Let's do it. Lucky number 7.
Oh, this is my lucky number.
The stakes are high in uterus transplantation for a variety of reasons. Roughly 25 to 30% of all uterus transplants done in the world have ended in graft loss because of a blood clot or this thrombotic event that we don't understand much about. There was a very real possibility that she would go endure a long and potentially difficult surgical procedure to lose the donor organ in just a couple of days, and that's very sobering. We had a series of conversations between Dr. O'Neill, myself, and Dr. Latif, who is another key member of our team and my co-pilot, so to speak, my co-surgeon.
We knew that for Jen's surgery to be successful, the collaboration between G1 Oncology and transplant surgery and the countless hours of training and practicing had to work perfectly in sync in that moment.
There's 2 major technical phases for a uterus transplant in the operating room. One is to actually sew the blood vessels from the donor organ to attach those to the recipient's blood supply. And the second other major phase is to actually establish the continuity between the donor vagina and the recipient's vagina. We have a special sterile area where we can keep the organ on ice to do any final surgical preparation, mostly ensuring that the blood vessels were up to the task that they had before them, which would be to not bleed when we reestablish that blood supply.
Cut this here longitudinally, right? And you just make this the lips right here.
While I was preparing the organ with Dr. Kovac and Dr. Latif, my surgical colleagues were working to actually open up Jen's abdominal cavity and prepare the area where the uterus is going to go. So we'll trim the vessels back, get everything down to here.
Okay.
Then you come over here and do the component here.
Okay.
And then I think we're ready to actually sew.
It's a stressful process. This is the scariest part, right? This is the part where things could really go wrong if they're gonna go wrong. So I'm just trying to keep my mind off that as best I can. I wish I could just be in there. I keep telling myself that these are like the best doctors in the world, so that's what's keeping me okay.
One of the things we worry about a lot in transplantation, and specifically with this organ, is the amount of time that the organ is outside of the body not getting blood flow. So we need to work fast to be able to get to the point where we can actually reestablish blood supply. This is one of the parts of greatest risk for the recipient, because when we reperfuse the organ and take the vascular clamps off, there's the potential for significant blood loss. I release the clamps. I'm not sure that I breathe. I don't even remember. The organ starts to pink up. You guys are amazing.
When the uterus goes from that whitish color to pink, it was incredibly exciting.
Profound relief, I think, is probably what I was thinking. In addition to the fact that we've got a lot more to do on this operation yet before we're done. The next phase is actually to complete the vaginal anastomosis, which is the sewing work between the vagina of the donor and the recipient. The pelvis is a notoriously difficult place for a surgeon to work. And this is where Dr. Latif's expertise as a gynecologic surgeon was invaluable.
For the transplanted uterus to be monitored, we have to be able to do biopsies of the cervix. My focus at that point was to make sure that this connection between the transplanted uterus and Jen's body is perfect. Because I knew it's not important just for that moment, but it's also going to be important for the next year and a half, because that's the only way we're going to monitor this organ.
It really required the three of us together to work at it, to change our approach, to do it again.
I'm really picking your brain on whether you think we should go here or go here.
The issue is going to be, because it's anterior vaginal wall, we're going to open here, the vagina going to sit here, it's not going to be there, it's going to be like literally.
So I mean, it's going to be more anterior.
More anterior.
That's okay.
Yeah.
You know, when she wakes up, she might have a uterus for the first time in her life. So that's a crazy thing. That's a crazy thing.
When we walked out of the operating room, we knew we still had a long road ahead of us, but the uterus was in place and was perfused, and the vaginas were attached, and the abdomen was closed. So that was a huge moment. It was a moment of celebration. It was a moment of success.
Thanks, everybody, for your help.
They're going to bring her up here to the ICU, okay, to the bed that she's at. And the nurses are going to settle her in, okay? So it's
Okay.
probably going to be an hour-ish till you can see her.
Okay.
The other detail is we will be road tripping tomorrow because the ultrasounds we do and the exam that we're going to do is going to be done in a different part of the hospital.
Okay.
So that's one of the ways we monitor how the graft is doing.
Okay.
I've seen so many uteri in my life, and this is a very, very healthy uterus, like before and then immediately after like transplantation. If you look at it, like to me, it looked as if like this is like a normal, natural uterus thing.
Deep breath, and we'll touch base later, okay?
Okay.
All right.
Thank you all.
Of course.
One of the first questions she had was, how did it go? Is there a uterus in there? And I said, yes, there is a uterus in there.
And I think I just started crying. And then I was so excited that something I never thought would happen happened.
It was probably another like hour before I could actually go up and see her. And they were like being all like somber, like I'm warning you, she's got a lot of tubes coming out of her and you know, blah, blah, blah. So like, I'm expecting this like horrid scene and like her to be like, you know, like half dead. And I walk into the room and I'm like, you know, hey, are you doing okay? And you know, she's like firing off jokes and like talking to people.
Maybe that could have been attributed to the pain medicine, but then I was just like extremely excited and happy.
I was ready to cry, and she's like, you're not allowed to cry, because if you cry, I'm gonna cry, and that's gonna hurt, so no crying.
Every gesture and every nurse, they were so kind. At points I was like crying over like how nice they were and how invested they were in us. It is refreshing to like move around, so.
How are you feeling?
I was riding the surgery high, and then like yesterday kind of came crashing down.
The Achilles heel of this operation to date has been the fact that there's essentially a clot that can form in the blood vessels that provide blood flow to the uterus or bring blood flow out of the uterus. And so we do a lot of monitoring of the organ to make sure there's blood flow.
How's the blood flow look?
Great. Nothing has changed at all. It's really nice.
You guys are filling my head with all this good news. I'm worried when the other shoe's gonna drop.
Let us enjoy the moment.
Yeah, you have to.
In uterus transplantation, the organ is tucked away inside the body, and we have no biochemical parameters, no blood tests, no great tests to actually monitor the well-being of the organ.
One of the ways we measure how the graft is doing is her actually having menstrual cycles and periods. So that's going to be, I think, an exciting day is when she has her first period.
That's not really embarrassing, it's just you in your uniform.
That was cute, Catholic schoolgirl. It is weird being a teenager and like seeing all your friends go through their rite of passage and womanhood and kind of feeling sort of left behind, and then now having it and being like, oh, so this is what you guys were complaining about all this year. That one's my most embarrassing.
Yeah, that's definitely it.
We were all thrilled because it meant that the uterus was perfused and the uterus was functioning. I celebrated that first period just like I did the end of the transplant surgery. It was really exciting.
Hi. Hi. How are you?
Yeah, nervous, nervous.
Okay, I'm not nervous. I'm just excited.
I'm excited.
Good.
He can be nervous.
So they thawed one embryo, and the embryo survived the thaw. Looks good. Josh is the embryologist back there. I don't know any information other than that they picked the best one, so we'll see.
My thing was, a lot of this is not normal.
Yeah.
Let's have the one normal.
Yeah, I like it.
We had not wanted to know the sex of the baby. We were waiting to be surprised.
Being surprised was something we could control and like something we had for ourselves that just was really simple and natural and, you know, not sort of high-tech or scientific.
I just have to decide if I'm going to stay in the dark also, or if I'm going to try to figure it out.
How good is your poker face, though?
It's really good.
Okay.
Spot on. I've done this a lot. Jen's embryos have been in the laboratory and were frozen. And this morning, we are going to directly place one embryo back in Jen's uterus. I just want to make sure you can see, Drew.
Yeah.
I can see.
I'm ready for lights down. We put a small tube through the cervix, just inside the uterus, and there's a little bit of fluid around the embryo. We push the fluid with the embryo inside the uterus, remove the tube, and Jen goes about her day. Ready. Do you see that little flash, guys?
That was crazy.
Deep breath, Drew. All right.
There's a white dot right there in the center. That's one of the bubbles that was beside the embryo. So
It was very quick, 10, 15 minutes and you're done. But it was just so much anticipation for like such a short little procedure.
Do you feel better?
And they hand you this microscopic picture of the embryo. That moment was big. Oh, gender, there we go.
Oh, you saw
no, I'm sorry.
I didn't see it.
It says on the picture, gender female, and I went, oh, they let slip that it's a female embryo. And the embryologist goes, can I see that real quick?
That's you.
That's me.
Oh, okay, all right.
And now we just get to wait 10 days to see where we're at.
Yeah, I don't know.
And you're gonna cry.
It's wild.
We know that the uterus is at least able to have periods, but we don't know if it's capable of carrying a pregnancy until we actually get that pregnancy test.
We're calling now.
Hello?
Hello?
Hi.
Do I have you both?
Yes.
Yes.
All right, the pregnancy test is positive.
Holy
I know, I'm gonna cut right to the chase.
thank you for doing
They were so happy. It was really a professional high.
I knew how excited we were, but I think that pales in comparison to what it's like to experience pregnancy as a woman who was told she wasn't going to be able to carry her own pregnancy.
How are you feeling?
I feel like I'm totally in a dream right now, and I'm having a lot of trouble believing it, but I'm really happy, and I'm just so excited for what's gonna happen next.
We get the pregnancy hormone level back, and it's positive, and then we follow to make sure that it's rising appropriately, and then we do an ultrasound to make sure that we see a developing pregnancy inside the uterus.
Full gel. Lots of pressure. Oh my goodness.
How much
So
bigger?
this whole thing right there with the little heartbeat right here, that's the developing baby.
That's crazy. Oh my God.
Heart rate is 156 beats per minute. Perfect. Sweet.
Aww, you're so cute.
I give you guys full permission to be excited and take a full breath because this is a huge milestone. 8 weeks and a heartbeat is a huge milestone. So,
I don't think he's breathed in like 6 months.
I haven't.
okay, I'm gonna give you a hug.
Oh, I'm so happy for you both. It's been such a long road, I know, for you guys.
Feel anything like flutters or anything?
I feel flutters.
We feel really lucky. We'll just be sitting on the couch watching TV or whatever. And then we look at each other and we're like, you're pregnant. Like, what?
It's starting to look like a baby and not a lima bean. Oh, the mouth just opened.
Yeah, I saw that. See, it's like this.
Oh! And the mouth just closed.
Yeah.
You see that?
That's crazy. She gets to experience some of the normal stuff that every pregnant woman gets to experience, which is have a shower, you know, feel the baby kicking.
Drew made this. It's a sonogram. If you'd ever asked me if I'd have a shower or a maternity shoot or any of those things like 2 years ago, I'd be like, that would take a miracle, and we're here with our miracle today. We were running like 30 minutes late from transplant, so.
Okay. A little bit higher this time, so I'm gonna let Dr. Wong know just to.
It was normal this morning when she took it. at
Yeah,
transplant,
I looked
so-
it up in your chart and I also let them know that, so I'll just let her know really quick. Stay put for 1 second.
Early after transplant, we could see the effects of the medications, the immunosuppression medications she was on. So it made her pregnancy more high risk. So we were suspicious that she might develop preeclampsia towards the end of her pregnancy.
So I'm gonna acknowledge your nervousness because I have the same nervousness.
Maybe this is a dumb question, but you guys keep saying like we should watch for these warning signs. Is that like, does it typically come on suddenly?
In someone who has gestational hypertension, there's a 2 to 3% risk of a seizure, and that's eclampsia, right? And eclampsia in Greek is lightning. And so literally, out of the blue, it could happen.
Finally, I'm talking to Dr. O'Neill, and she said, you know, I think we might want to have Drew come. I think just in case. I'm still not thinking like, you know, labor or anything like that. And then I got the headache.
In the end, she developed preeclampsia that could not be managed further, and the decision was made for her health and for the health of the baby to deliver her prior to 37 weeks.
All this was such a long process, and every part of it has been so planned and regimented, and this is when it's happening. But the two big moments, the transplant and the delivery, were like, no, now.
And it was like, oh, okay, we're doing this.
As a G1 oncologist, I've done countless pelvic surgeries for cancer, and I've done C-sections before, but we didn't know how the transplanted uterus will behave, especially when Jen has preeclampsia. So we have to move very efficiently for the baby's safety and Jen's safety.
You're in the operating room and there's so many people in there, and then it happens so fast. Like the C-section takes almost no time at all, it seemed like. Once they started, it was a few minutes.
Drew, what is it? What is it?
It's a boy.
Okay.
It's a boy.
We have a boy. Okay, okay. Hi, guys.
Boy.
It's a boy. We have a little boy. And I love that.
I will never have the same feeling that I did in that operating room. Drew cried and was so appreciative of that baby. It was an incredible, incredible moment.
I had to wait like a whole 24 hours before I could actually like go and see him in the NICU, and so I cried a lot having him in my arms and doing well and, you know, being there. And it was just something I'll never forget. When we first started this journey, I really thought that there was such a small chance that I'd be here.
We feel really lucky. What I think we want out of this as much as anything else is for other people to get the opportunities that we got, because everybody deserves to start a family if that's what they want. And if we can contribute in any way towards other people being able to have that opportunity, it's hard to explain how much that would mean, because it's so special. So everyone should get that chance.
I couldn't say it better myself.
The joy that I saw in Jen and Drew's eye when they have their baby was out of this world.
When I saw Jen and Drew's reaction to that child, I think in addition to love, what I bore witness to was, you know, a sense of accomplishment, that they had reached the finish line of a place that they never would have thought that they could get to.
I felt incredibly proud of the team, that everybody worked together to do this for this couple.
People talk about miracles and it's like this weird ethereal thing. We got to not only have one, but witness the people making a miracle happen.
That we were able to help them get there is professionally and personally satisfying.
There was this sense of job well done, but at the same time, oh my God, we need to offer this option to so many women out there.
You get a taste for what that is like, and you realize that it's not enough to be able to help one patient. It needs to happen over and over and over again.
I think we like being parents. I love it. I think you like it.
We definitely had a different path to take than most. And now we're here and we get to just enjoy it. And I'm trying to enjoy every moment of it.
That first bath and that first bottle and that first holiday, they're little things, but it's cool to be able to experience them.
I don't know what the future holds, but the present is pretty great.